Coming at you live today. We have a workshop on Tuesday all for kids, and there's a problem because only 12 people so far have signed up for this, and in my eyes this is really not okay. We love kids and we want to really help kids be drug-free and have the health of their dreams. The sad thing is now is that actually infants, so if you're 0 to 1 years old, 227,000 infants are now on an anti-anxiety medication. Right, if you're a teenager, over 8 million people are actually on psychiatric medications. So in my eyes, this is not okay, and that's why we set up this amazing health workshop just for kids to get them to be healthy and show them how the nervous system is there to make them healthy and how nutrition and exercise are all good things. One of the main things is actually Nikki here. She's been our CA for the last couple of months. She's gone through pretty much a hard life when it comes to health. And these are her x-rays, and she actually wants to share her story and her testimonial on how she got her health back. So, Nikki?
Hey, thanks guys. So I'm really passionate about this kids workshop that we've got coming up on Tuesday, and it's mostly because of these x-rays here. So when I was 12 years old, I was diagnosed with scoliosis, and it was really debilitating. I looked very crooked and got made fun of for it as a kid, and the pain alone was just unbearable. I was very active in sports, and I had to sit out on the bleachers because I was just in so much pain. So my family, we didn't know that there was any other way to go about it besides the surgery that they had suggested. And to me, as a 12-year-old who was innocent, I just wanted to be pain-free. I wanted to get back to doing the things that I love to do. So I went forward with the surgery. But we didn't think about the repercussions of that surgery that would follow me years, even 13 years later now. And since then, since the surgery has been done, I've had even more health issues. I've had pain above and below my fusion, my neck and my hips and my shoulders. And I've had digestive issues, I've had fertility and hormonal issues. In fact, it was last year that I had a miscarriage because my body just couldn't house the child. And that alone is just some of the worst pain I've ever had to deal with in my life. And the point is that, the doctors don't really think about how the nervous system controls every single function and organ and system in your body. And that's the thing, is it does. It is so important for kids to get checked because scoliosis, it's 38,000 patients or kids per year that get these spinal fusions. And that was a study done in 2007. The number has even grown since then. I also did a study about how kids and fusion patients, they just go back onto the operating table to get more fusions above and below what was previously fused because of the damage it does later on. I don't want this for anyone, and this is why it's so important to get your kids checked. So I really encourage you to like this video, share it out with everyone you know that has kids. If you got grandkids, nieces, nephews, whatever, get them to come to the workshop, learn a little bit more about health and wellness, and then get them to get scheduled for our kids special the 17th through the 19th, just so that we can save lives, and that's what our goal is here. So, thanks.
Absolutely. So yeah, thanks Nikki for sharing that. So don't run away. Come over here. So I just want to get into this a little bit more, but when you were 10 years old is when they found the scoliosis, right?
Yeah.
And what did they say when they found it at 10 years old? Did they say we should do the surgery now, or did they say let's just wait and monitor this until you get worse?
Yeah, so it was, they waited. It wasn't bad enough for surgery, it was too little for a brace. So they decided to just wait. And every 3 months I would come in, get x-rays, and then it was the same thing. Well, it got a little worse, but it's not bad enough for surgery. You're too small for a brace, so 3 months we'll see you again.
All right, so that's scary because your lung was collapsing, organs were shutting down, so you're in serious issues. So instead of waiting until you get worse and then putting spinal rods into your spine, we want to check it and start correcting it structurally so that we can actually change the muscles. So you put a brace on a kid, they're just going to atrophy more, just going to continue to get worse. Our focus is on actually checking infants, and start early and keep them healthy. Don't wait until you're really, this sick. But since you've been obviously having the rods, you've been getting adjusted, the neck and the tailbone, because that's all we can move.
Yeah.
And your health has been skyrocketing, just coming right back. So amazing testimonial. So we do want to help as many people as possible. So we'll put the link below to sign up for the workshop on Tuesday. But all are welcome. Come and we'll talk about how to keep your kids as healthy for life. So thanks for joining us, guys. Share this video. Thank you.